Mm-hmm.
Hey, my name's Lindsay Ray with MEREM Healthcare Solutions. I'm the Vice President of Operations. This is
Jennifer Smith, I'm the Director of Billing Operations.
And I'm Courtney Rich. I'm the Financial Planner for MEREM Health.
and we're here today just to answer any questions anybody has regarding our services. I do want to remind everybody we do have a free billing audit that we can do for you if you're interested in our services. So until we get some people joined, we're going to go over some questions, some frequently asked questions that we get. Courtney, I think I want to start with you, and as far as our patient collections,
Okay.
kind of explain what we do.
Okay, so for collections, we typically start out with sending the statements to all your patients, and then we work with them as far as setting up payment arrangements for any balances that they may have. And then for any delinquent patients, we do send out collection letters, and we also offer collection services for patients that do not apply to their payment arrangements.
Mm-hmm. So, and that's an additional service that we can offer. It's basically like a pre-collections before sending your patient out to a collection agency. We'll call them and try to collect. Now, Jennifer, I wanted to talk about some of the questions we get regarding billing. So, go over some of the common questions you get, because I know that you get a lot of questions.
One of the biggest questions that we get in the billing department is how are the denials worked? So our billers are constantly working denials as they come in the door, and
They're worked pretty much every day.
yeah, that's part of their daily process. They work the denials every day, and so they are hit on any that are outstanding as well as the ones that are currently coming in.
And then, and aside from that, so we work your denials, we bill out your claims, work your denials, follow up on any claims that we haven't gotten a payment for. So we'll call and get claim status. Our goal for our billers is to keep your AR below industry benchmarks. So we give our billers bonuses based on keeping your AR healthy. That's our main goal. The more money you make, the more money we make.
Mm-hmm.
So. Another frequent question that we get for billing is, do you take our patient phone calls? Because I know a lot of practices get patient phone calls saying, well, why do I owe this bill, or what is it for? And then that takes time away from their day to have to answer that. So what we do is we provide
We will set you up with your own direct dial that comes straight to your billing team. So we will take all your patient calls, take your credit card payments for your patients, and answer any patient questions that come across.
Yeah, so you basically have your own dedicated team with us, and your patient knows no difference. Another question we get is reconciling payments. So how do you know when you're posting a payment that it's actually in my bank account? And so with most of our clients, we either get a bank statement at the end of the month or read-only access to their bank account so that we can just verify that the money that we're posting matches with what's in your bank account, so we know that you're not losing any money at all.
Mm-hmm. And then we will also be able to see any money that hits the bank that we're not receiving EOBs for, so that we could go back to that payer and make sure that those are being sent to the correct place.
Mm-hmm. So, and along with that, our billers, they like to, we like to do a denial tracker to keep up with, is your practice having a lot of denials in one area? Can we prevent those? And so we'll help you with your front desk to, kind of prevent those on the front side so you can get paid faster.
Mm-hmm.
Another question that we get regarding billing is there's so many different insurance companies, so many different guidelines, and we get, how do you guys keep up with it all? And that's a benefit of going with a billing company, so that you don't have to manage that with your staff. You can focus on your patients while we worry about the different changing guidelines.
Mm-hmm.
So
we are constantly trying to grow our staff here at MEREM and give them the knowledge they need to be able to succeed. So once a month, every month, we hold a continued education for the billing department as well as the coding department. We take advice from our staff on the types of things they want to learn, as well as any new changes that are happening in the healthcare field, so that they're very knowledgeable, stay knowledgeable on everything going on.
Right. And so that brings up coding. I would say one of big areas that sets MEREM apart from other revenue cycle companies is that we do have very educated, certified coders on staff. Even though a lot of practices are on EMRs now, we still have a certified coder go through each note and code from that. So basically, we're not going to trust what your EMR is saying that your CPT codes and ICD-10 codes should be. We're going to go through and make sure that it is, that we're going to change it. So if your EMR comes out with a 99213, a level 3 established patient visit, but our certified coder goes through and looks at it and it should have been a 99214, they're going to do that and make sure that you're not losing revenue there. We have certified surgical coders as well, depending on your specialty. So they get your surgeries from the hospital or from your EMR, and they code those daily as you get them. And they are continuously having to get updated on guidelines and things like that. I would say that is probably one of the main things that sets us apart.
Mm-hmm. One of the other things that sets MEREM apart is we customize ourselves to the client. We don't make the client take on any particular system. We adapt to how they're already used to doing things. We may offer them ideas and things that they can improve on with the things that we find while working their account. But bringing up the EMR, we have been in so many different systems that we have been able to see that having that backup, those human eyes on there, the PM systems, they are not accurate all the time. So we have double coverage in every area to look at everything and verify that everything's correct and accurate and giving you the highest reimbursement we can.
Mm-hmm. Yeah, I would say that's probably when we take on a client, we do work with so many different systems.
Mm-hmm.
That
and we help them when they're changing systems to build their systems also. So,
yeah, so that is another good thing. We're not going to make you go with a system that, we own or we endorse. We're going to go with what your practice is used to, what you want to use. We can always make suggestions, but if you're already used to an EMR and a practice management system, then we're going to adapt to that with you. You can basically think of us as an extension to your practice. So I'm going to go through some of our other frequently asked questions. So a lot of times we get, when we get on a new client, their previous billers or their previous billing company, they never really received any type of information from them as far as how we're doing financially or what their revenue cycle health was. So what we do is we provide you with monthly reports and scorecards, and we'll go over that with you monthly and mark trends in your revenue cycle. So if your revenue is down, then we're going to look and see, well, was your volume down? Were we experiencing a lot of denials that month? Kind of what the issue was. We'll give you reports on your payer mix so that you're aware of who you're seeing the most. Is it Blue Cross, Medicare, the commercial plans? And we'll also give you a breakdown of what you're making on certain procedures.
And your payer mix is extremely important as well because Blue Cross may pay in just a couple weeks. So if you have more Blue Cross, you may have a higher reimbursement that month. But if you have more commercial that month, then it may take a little while longer because you could see it 30 to 45 days.
For commercial payers, yes. Another question is, do we have to change practice management systems, which I just covered? You do not. We'll adapt to any practice management system if you guys give us access. Another one is we still use a lot of paper charts and documents in our practice. Do we have to go EMR? Well, that's the same one. It kind of repeats itself. And then the next question is we use how are your insurance denials worked? And we kind of briefly went over that a minute ago. But even talking about practice management systems, there are some practice management systems that have I think of it as like a page with a list of all of your denials that you need to work for that day. So we track our billers that way. They need to go in there and work those daily. Some systems don't have that, but we still, with our payment posters, we still have them mark those claims so that the biller knows to follow up on them. Do you post our insurance and patient payments?
We do post your insurance and patient payments. We post electronic payments that come through from your bigger payers like Blue Cross, Aetna, Cigna, and everyone that we can get set up to come electronically. Your EOBs will be electronically posted in the system and stored within the system. Anything that we receive by paper will be manually posted as well by the payment poster, and the denial codes and everything will be posted and attached to that claim.
Right. Okay, and will you work down our outstanding patient accounts receivable? And so that's kind of what Courtney went over at the beginning. Tell them kind of your process of when you know to call a patient.
Okay, so as far as working down the patient accounts, we tend to try to reach out to the patients after we notice they've received a few statements and either they haven't paid on their accounts or they've fallen behind in paying. And so we try to reach out to them, make sure they are still getting their statements, make sure an address hasn't changed, because that will cause them to stop getting statements, or either they won't pay on their account or they've had a change in card information. So we do try to keep up with that information and just make sure that everything is staying up to date.
Yeah, that, and also with that, as far as setting up your patients on a payment plan, we'll kind of we'll give you suggestions on industry standards, but if there's a certain plan that you've always went by, then we'll hold to that policy for your practice. So if you have a 3-month rule, a 6-month rule for those patients, we'll work with those patients to get that payment arrangement set up in that time frame.
Also, Courtney also sends statements weekly for all the patients, and then another thing Courtney does is she manually goes through and reviews each statement before it goes out the door to make sure that it is an accurate statement, because
Right.
there are errors within the system and things that do happen. So
Yes.
she manually reviews those and makes sure that they go out the door before you're charged for them.
Right, and we don't want your patients to get a bill that's not accurate.
Right.
We want to make sure that they stay happy, so
Yeah.
you stay happy. Let's see. How do we take payments from your patients? So, like I said before, we give you a certain phone number that is dedicated for your practice. And when they call and want to pay over the phone, we'll take their credit card information and log into your merchant service carrier and run their credit card. So it's basically the same thing as if we were at your practice, but we're doing it through an online portal instead of having a credit card machine.
Mm-hmm. And if there is no online portal, we do have a couple clients that we have to send in daily, and the clinic has to run those accounts if they have the credit card portal in their office.
Okay, so the next question that we have is, let's see, how many, do you guys work in different states or just local? We work pretty much throughout the United States. I mean, we have clients in, Las Vegas, Kansas City, Florida,
Missouri.
Missouri, all over the place. There's so many
Alabama.
more.
Georgia.
So we're definitely well versed in all of the different states and their guidelines, and that is part of what we do daily to keep our staff educated. Is keeping up with all of the changing guidelines in healthcare, as I'm sure everybody's aware of. Okay, let's see. Do you make sure that your coders are certified? Yes, every single one of our coders have to be certified before they're hired on as a coder. We go through, all of our office visit coders have to be CPC certified through AAPC or through AHIMA. So with our surgical coders, they'll usually get specialty certified. We work with a lot of different specialties, and there's a lot of different specialty certifications. So we make sure that everybody is certified in their specialty. Speaking of specialties, we do work with pretty much every specialty. Some of our bigger specialties that we work with right now are orthopedics. We're really big on orthopedics. That's how we got started. And pain management, anesthesiology. We do urology a lot. What other specialties? We got a lot of specialties.
We just cardiology, and
Gastro, dermatology.
Yeah.
There's a lot. We work with spine surgeons, podiatry. There's a lot. Our website lists all of them. And if anybody's ever, anybody wants to even just try out to see if they are even interested in switching to a billing company, what we do is we offer that free audit that I was talking about at the beginning. And what we'll do in that free audit is we'll basically get a BAA with you, and we will go and get access to your practice management system, and we'll take a sample of your charts and what was coded versus what should have been coded, and give you a score on that, as well as look at the health of your revenue cycle. So we'll look at basically the same reports that we do for a client on a monthly basis. We'll be providing you in this audit so that you can see, how healthy is my revenue cycle. Could I benefit? Could I make more money? Basically.
Yeah, one of the biggest things that we see during these audits are there are a lot of companies out there that do not fight a lot of claims. So there's high amounts of adjustments that we're finding that could have actually been paid if they were appealed.
Right. Yeah. Recently we did one of those audits for a new client of ours, and we found out where basically every single one of their denials for the past 2 years was written off by the payment poster. I don't think that it was something that they knew they were doing wrong, but it was definitely something that was causing them a lot of money.
They actually joined us, and there are actually claims that we're able to refile past that are not within timely filing, and we're going to be able to refile them and actually get payment for the claims that were adjusted off by the old billing company.
Let me just think of some other questions. See if we got any.
Nobody has any questions?
Okay. Another question is E&M visits. I know a lot of providers, if you're a physician and you're coding yourself, I feel sorry for you. But we can help you with that. And recently, a different client that we did an audit for, they were scared to use higher level office visits. And in their specialty, it was common. They see chronic conditions, so it was common for them to have higher level visits because they're treating chronic conditions. So, but they were billing out a level 2 for basically everything just to stay safe. And I get that, but I think that if you have the certainty and you basically security of knowing that you're billing it out correctly, then you shouldn't have to worry about that. Because if in case of an audit, you've had a certified coder go through there and check it for accuracy. They had lost over $100,000 in just a year from billing out level 2s, because with their specialty, it was indicated that they could bill out level 3s and 4s, on average most of the time. So every office visit level, I would say on average nationally, it's about from a level 2 new patient to a level 3, that's about a $30 to $50 difference. From a level 3 to 4, it's another $30 or $50 difference. And that adds up. After you see 300 patients a month or 400, whatever it is, that adds up over time, and it definitely decreases your revenue. Any questions y'all can think of?
Probably one of the biggest questions that we do receive are, what services do we offer? It's not just the patient pre-collections and the billing and the coding. We offer a multitude of different services, like the auditing and consulting. We could actually come into your clinic and see if there's anything we can improve on, even if you decide not to go with us as your billing and coding company. Credentialing is a big part of your revenue cycle, and we can perform a credentialing audit as well as we have the knowledge to get you credentialed with all of the payers and start having that money coming in a lot faster.
We do payer and facility credentialing. So basically, we'll give you if you're a new practice just starting up, we'll give you a list of insurances and you'll tell us, which ones you want to be in network with. And then we'll, get the applications together and then send them to you to sign, and we'll do the rest. We'll follow up, make sure that you get your contracts, and you can review your contracts prior to signing. So that is one big thing. There's a lot of practices that lose revenue from credentialing, thinking that they're contracted, but they're actually not.
Yeah, and with all the Medicare changes and all of the insurance plan changes that happen constantly, you may see a Blue Cross card come through your door, but you may not be credentialed with the actual Advantage plan that it is. So you just have to make sure that all of those, you're covered under all those different areas, because there's just a lot of confusion in the insurance world right now with the Medicare replacement plans and everything.
Mm-hmm. Yeah. So that is another good service of ours. And like she said, we also do consulting. So it depends on the practice, on how in depth our consulting services go, because we do it tailored to your practice. So we don't just do the same thing for every practice. So depending on the needs, we do everything from management of the entire practice to just training, or just a temporary training and consulting. So it really just depends. But if anybody has any questions or would like more information on that, just go
That
to our
brings up
web.
another question. So what services are included if you choose management? So we would be responsible for your accounting,
Mm-hmm.
and we would be responsible for your staff and everything. We would do
all of your
Yeah.
training, everything that you have to do in your practice now
Mhm.
for management. But we have experienced people who have done this all over the United States. So
Mhm.
basically come in there, make sure you've got the right staff hired, make sure they're trained appropriately, make sure that all of your
policies
and
are
procedures are up to date. Basically everything you do now, just more in depth.
Mhm.
But if you want any more information on any of that we just talked about, there's a ton, I know. But you can always go to www.meremhealth.com and check out the entire website. Check out our FAQ page. Check out our blog. Our blog has a lot of good information that we update monthly, weekly. And go to the Contact Us page, and we'll get back with you very quickly. So, okay, well, if there's no other questions, y'all can think of any? Okay. Well,
Thanks
thank
for
you for
joining.
Thank
yeah,
you.
thanks.
Have a good day.